Hi guys, so if you are watching this, you have probably seen our pregnancy announcement. So we're filming this in the future before all of this because I wanted to really document this process and really let you guys in and share a glimpse of what in vitro fertilization is like, what the process is like. So I convinced hubby to allow me to film it, but we aren't going to share it until we know that the process has worked. So we are actually right outside of the doctor's right now. We did our process through Kaiser Permanente, which is where we go through our normal doctor. So today is our injection class. So I'm going in today to learn how to do all of the injections, to how to administer them myself. Today is Tuesday. I will be starting my injections on Monday. So they'll be morning and night. The amounts are going to vary, and they will vary per person as well, depending on your situation. But yeah, so I'm hoping this is helpful for you guys. I don't believe they're going to allow me to film in there as it is in a hospital, but I'm going to document as much as I can for you guys. The reason I wanted to do this is because when I started the process, I have an amazing friend who did the process, and I was able to ask her all of these questions. But as I was looking online, I could only find blogs, writing, you know, of what girls had written. And I mean, I like to read, but I really wanted to dive more and hear the emotions and see the emotions. So I am filming this. Hopefully that down the road can help future females, future couples going through this process as well. So
let's dive on in.
Let's do this. I just finished the injection class, and my initial thought was I was shocked at how many couples were in there. It was actually very reassuring knowing that there's a lot of people in our same position and having the same struggles. There was like probably 15 couples in there. It was sad, you know, seeing that many people struggle, but again, also comforting knowing that we're not the only ones going through that. But it was very thorough. She went over every medication option. She answered all of our questions. I now have a very clear picture of how to mix my medications, how to administer them, when to take them, and then also what questions I need to be asking my doctor throughout the process. So again, if you do decide to do IVF with Kaiser, so far it's been very informative and very thorough, and I feel very comfortable starting this process. Good morning. So after the injection class, I felt very well prepared for all of the injections and all of the medications throughout the whole process. So I actually did this to organize them. I found this idea on Pinterest. So I got this jewelry organizer at Walmart, and then I was able to label everything. So all of the syringes for each of the medications, the antibiotics that I'll need to be taking. These are the Menopur, which is actually the follicle stimulating hormone. Some of them are in the fridge because they do have to be refrigerated, but gauze pads, alcohol wipes, and then I have a calendar laid out as to when I have to take my injections, what time of the day. And you know, I only have a few days filled out because they did only give me the amounts for the first 5 or 6 days or so, and then as I come in for appointments, they'll update me to either increase or decrease the medications based on how my ovaries are reacting. So I hope that's helpful. I hope you can find a way to organize your medications like that, because I feel a whole lot better knowing this is where I go and I can look at it and I know what time and what amounts. Good morning, guys. So I just went over to the laboratory to give blood right here. So today was my baseline ultrasound. So when you start the in vitro process, you will do a baseline exam and ultrasound before you start your injections. So today is Thursday. I'm starting my injections on Monday. So I came in today to do a blood test and do a baseline ultrasound so they can see where I'm starting before all of the medications. And then just a side note, you will be giving blood every appointment, and they want you to do it in the morning before 8:30 so you can get the same day results. In my case, it's a little annoying because the fertility clinic that I go to with Kaiser is like a sub office and there is no laboratory. So I have to wake up extra early because the IVF appointments are early, go to a hospital that does have a laboratory, then go over to the clinic. So I drove over to the Santa Clara hospital, and then now I have to drive over to Sunnyvale to go to the clinic. Okay, so I just finished my baseline ultrasound. Like I said, it's so they can kind of check your base, you see where your ovaries are before the medication, and they're also checking for any last minute issues like cysts or polyps that may appear and would kind of delay the process. But it looks like I'm all good in the hood, and I'm ready to start my injections on Monday. Good morning, everyone. So today is Monday. It is the first day of my injections. So starting out, I have an injection in the morning of Gonal, and at night I'm gonna have one of Menopur. That may change throughout the process. And just a reminder, guys, I am not a medical professional. I'm just sharing what was assigned to me by my doctor. So make sure if you are going through this process, you are touching base with them and doing exactly what they tell you. I'm just sharing my experience again. So I'm gonna get prepped for my first injection. I'm a little nervous. I'm starting to sweat already. But yeah, so let's do this. So again, my calendar is over here. I have it all labeled out on what day I'm taking my medication. So I'm gonna grab a gauze pad, an alcohol wipe, and the Gonal is actually in the refrigerator. Okay, so this is what the Gonal looks like. It's like a pen. So you just take the cap off. It's kind of hard to take off. And you can see there, that's where I screw on the needle because this is gonna have multiple doses. It's not just one. So I wipe off the tip of that. My hands are shaking. I'm not a big fan of needles, guys. So I wipe off the tip of that, and I just got out of the shower, so my hands are clean and sanitized as well. And then the needle comes in this little thing. You just break off the seal and you screw it on. And then there's a safety cap, and then there's another safety cap underneath it. So I'm gonna get the gauze ready. And take another alcohol wipe, and I'm gonna wipe my injection spot, which all of my injections are gonna go here in my tummy. And guys, I'm just gonna kind of show you how I prepare for it. I'm not actually going to inject because I do not know if YouTube is gonna allow me to share it. So I'm gonna go up to the very point where I do inject it, and I'll talk to you afterwards. But I don't wanna get in trouble with YouTube. So I'm gonna wipe the spot I'm gonna inject in and let it air dry. And so you're always gonna inject around this area. It's a subcutaneous injection. You're gonna pinch the skin. I'm gonna demonstrate it with the cap on. I'm not actually injecting. Pinch the skin. You'll come in at a 90-degree angle after you've dialed your dose. Remember, dial your dose, whatever your doctor tells you. Come in at a 90-degree angle, press it in, and you'll come out and wipe it with the gauze. So I'm gonna shut off now, and I'm gonna do my injection, and I'll check in after. Okay, so I'm all done with my injection. I had a little bit of a hiccup and had to call the nurse because that pen end kind of jammed, and it turns out I didn't end up putting the full dosage, so I had to do another dosage, but again, trial and error. That was my first injection. The needle did not hurt at all. Like, I do not like needles whatsoever. I was sweating, I was nervous. I had to do it twice right now because I did it wrong the first time. And it doesn't hurt, not even a little bit. So for those of you who are afraid of the needles, do not be afraid of them because it doesn't hurt. Okay guys, so it is now time for my nighttime shot. I am taking the Menopur. So this one is a little bit different, so let me show you my setup. Okay, so the Menopur, I actually have to mix myself. So So it comes with a little vial of sodium chloride and then the actual powder of the Menopur. So I have to mix the sodium chloride with the Menopur. So to do that, I'm going to use this little thing, and forgive me, I have no one helping me film today or for this time. So let me see if I could do this. Okay, so I've washed my hands. So to begin, I take off the caps. I took off the cap already. I take off the caps off the two little vials. And then I take my syringe and open it up. And I'm gonna take an alcohol pad and I'm gonna wipe the syringe and the caps of both of these. Then I take this little guy, and this is what's gonna help me mix. So I'm going to screw the syringe onto the tip of that, and I poke it into the sodium chloride, like so. Oh, wait. Actually, I have to draw 1 millimeter of air. I forgot that part. 1 millimeter of air, then I'm gonna poke it into the sodium chloride and push that air into it. Then flip it over and 1 millimeter out. Okay, so I have 1 millimeter of the sodium chloride, and I'm now going to poke it into the Menopur mixture. Push that in there. And it says to slowly swirl it, not to really shake it. But swirl it till the liquid is clear. And it looks clear on my end. So then my dosage for this is 0.75. So I want to pull out 0.75. Okay, so that was a little bit of a task. So I have my dose in there. Now I'm going to take my needle and get that ready. And again, it's another one that I screw on, so I have to take off this guy and then screw on the needle. And so my needle is ready for when I need it. And I'm going to alcohol my stomach and again inject it in the same place. And again, I'm sorry, but I'm not going to be showing it to you guys because I do not want to get in trouble with YouTube. But it all goes in this area. So I'm taking a fold of skin. I'm going to be injecting straight into it and slowly pushing it in. So I will check in after the injection. Okay, so that one is a little more painful than the morning one. I'm not gonna lie, just a little bit more of a pinch, and then it does kind of burn, but I did it, and yeah, so I'll check in the morning. Okay, so one thing I forgot to mention is they have you take an antibiotic. Both you and your partner will take an antibiotic the night you start injections, and they say like take it with food because it might make you nauseous. So I ate a big chicken salad before, and then I took it, and it's about 40 minutes later, and I'm really struggling to keep it down right now, so I'm trying to eat some raspberries to stop me from throwing it up. My stomach is very, very upset right now, so side note, eat a massive meal before you take your antibiotics. Good morning, everyone. So it is day 3 of injections. I'm pretty uncomfortable now. I am super bloated. Can you hold this? Sorry, he's prepping my morning injection. But I am so bloated. You can see how bloated my tummy is. And I'm having like some kind of like gas cramp pains, like right here where my ovaries are. So after day 3, it's a little uncomfortable. Yeah, that's my update. So I'm gonna take my morning shot now and I'll check in later if I have any updates. Good morning, everyone. So today has officially been a week of injections. I'm getting ready to do my morning one. And I wanted to show you a mistake that I made that hopefully I could share with you and you can prevent making the same mistake. So if you are prescribed either gonal or follitism, it's a different drug, but it comes in this pen too. So they have their little doses, okay? So you scroll to the amount that you need to dose. Each of these pens, at least for the gonal, gave me 2 doses, and then there's just a tiny bit left over. So instead of me using that little leftover, I was waiting and I would just start a new pen. So now I'm out and I have to poke myself 3 times to be able to get my right dosage. So today is going to absolutely suck. But the pens are very, very expensive. So I do not want to order more to prevent poking myself more. So lesson learned. Make sure they're using the pen absolutely entirely before you move on to the next one. Okay, and one thing I want to point out, so you know how much more you have to do left by after you inject what is left in the little dial. So I put my dosage of 150, knowing very well that there was not 150 in there, and 75 is what's left over. So hopefully I just actually have to poke myself 1 more. So the next pen, I will dose 75 and poke myself with that. So there was not enough left in that second pen. I still have 12.5 left. So I'm going to take the third pen and do it again. Please guys, do not make this same mistake that I did. It sucks. So 3 pens later, I have now taken my full dose of the gonal. So yeah, lesson learned guys, that was not fun.
Okay, so I did my 2 injections. Like I said, the Menopur one always burns, but the Ganirelix, which is the new shot, is a larger needle, so it hurts a lot more going in, and I couldn't find a spot that hadn't been poked, and it like just hurt, and I just had a little bit of a meltdown, but doing what we gotta do, right? Just a few more days.
Hello everyone. So today is day 8 of my shots. I had an appointment this morning and she had been estimating that they would trigger me tonight, but she decided we're gonna do 1 more day of shots. But unfortunately, I did not have enough medication for tomorrow morning. And then the pharmacy that I ordered from, I live further than their same day service. So we had to drive up to San Jose and we're meeting a courier in a parking lot. I feel kind of shady, like we're doing a drug deal.
At Starbucks.
At Starbucks to get the rest of my medication so I can do 1 more day of shots. So I just have tonight shots and then tomorrow mornings, and then we will trigger me at night, and 36 hours later I'll be doing my surgery. I'm feeling like crap. I'm super bloated. I'm waddling because I'm in so much pain. I went to the doctor's this morning and I had to go do my blood in the morning like normal, and I had 3 nurses come up to me and try and put me in a wheelchair because I was walking so funny. Yeah, so I'm really glad it's almost over. So we just completed our drug deal in the Starbucks parking lot. I got my Ganirelix, so that's my gonal and my Ganirelix, and they even gave me candy. Okay, so I finished my shots. Last night they split up my trigger into 2 days. So the trigger is a trigger shot. Every woman will be different, but they are giving me Leuprolon, and they split it up over 2 days. So I did 80 units last night, and I'm doing 80 units this morning. And then Friday morning is when I will have my egg retrieval surgery. So Leuprolon hurts. It's a little bit of a bigger needle. It's a large dosage compared to the other stuff. So yeah, it's not fun. But as far as how I'm feeling, I'm still pretty bloated. I'm in quite a bit of pain. The doctor did diagnose me with ovarian hyperstimulation syndrome. So my estrogen levels climbed a little bit too high. So my ovaries are very swollen, very tender. The good thing is that I'm producing a lot of eggs. So we'll hopefully have a lot of eggs to choose from to make some good embryos. But I am very uncomfortable because of it.
So I'm gonna get in trouble for taking this video, but they gave us sperm. Well, the surgery went good. We got 33 embryos.
Eggs.
Oh, eggs. Yeah. So she's tired, sore, but she gets apple juice. Check in with you later.
Hello everyone. So I wanted to give an update. We've just been waiting for a while, waiting to hear from the genetic testing company. We had a total of 4 embryos that did not have my genetic problem. So we started with 12. 4 of them are actually good, do not have any chromosomal imbalances or any issues like that. So we will put 1 of them in and have 3 for the future. Now what's happening is we kind of had that waiting period. They had to put me on some birth control because we didn't quite know how long the genetic testing would take. So in a couple weeks, not even a couple weeks, a week or so, I will be starting another round of medications. It's a different set of medications. This one is prepping my body to receive the embryo. So it's a mixture of pills, some like hormone patches, shots, other things like that. So I will be starting that in a few days now. So I'm gonna be updating my calendar and getting everything ready for that. I have all my list of medications that I need to be taking. So again, I have, my handy dandy little medication storage thing and my calendar. So I'm gonna be updating on here on what days and what times and what amounts I will be needing to take the medications. So I got my second set of medications. This next round is mainly hormones to get my uterus ready to receive the embryo. So let's open these up and see what drugs I'll be on now. Okay, so we have more syringes. These are for the progesterone. Yay, more shots. And these ones are not going to be in the stomach. I believe they're going to be in my glute. So it has to go into the muscle. It'll be supposedly more painful than the last round. Another sharps container for the needles. More gauze and alcohol wipes. That's all the paperwork for the meds. Okay, so these are estrase. I'm not quite sure what that is, but those are the pills that I'm going to be taking starting twice a day. Starting 1 pill twice a day, then going up to 2 pills twice a day. This is progesterone. More progesterone. These are so fun. These are suppositories. Yay! So those of you who are going to be going through in vitro, you will be having to do suppositories towards the end to prep your body to receive the embryo 3 times a day. and estriadol. Oh, these are patches. These are slow release patches that I will be wearing to release hormones. And more suppositories, yay. So those are the next round of drugs for, to prep my body to receive the embryo. It's about 3 weeks of medication, so not too bad. And most of them are pills, patches, and suppositories. There's only 6 shots total, which I'm really grateful for. Good morning. It is November 5th. They are putting the embryo back in me on November 25th. So in 20 days, I'm starting another round of medications today. It's quite a bit different than it was last time. This time it's mostly pills and patches, mostly. There are some other things that I have to do as well, but today I already took an estrase pill and I have an estriadol patch on. So this patch stays on for a week and I replace it every week. I'll be taking pills twice a day until I start the other steps, which are suppositories, yay! And then I will have some progesterone shots into the muscles. So when I start those, I will explain how those work. Good morning, everyone. So it is a Tuesday, so I wanted to share an update. I switched my estrogen patches. So once a week, if you're doing in vitro, you're gonna be doing these estrogen patches. They sit on your lower stomach. I wanna show how irritated and aggravated your skin gets. It feels kind of like a sunburn. So when I take it off, I wipe it down with like a gentle toner. I use like the Mara Badescu Aloe one. It's very gentle. And then I put on some hydrocortisone cream to help kind of soothe it. And I wiped another area with alcohol, and I'm gonna apply the other one. They go on your lower stomach, so it's pretty darn simple. You just gotta make sure that the area that you're gonna apply it to is clean and dry. So I wait until the alcohol fully goes away. And it looks like this. It's very, very self-explanatory. It has a little peel off back, so I apply the bigger side first. So I peel off the back of the bigger side, and I just stick it on my lower stomach, and then peel off the back of the smaller side. And you want to really press down and make sure that the edges of it are secure, because that's actually where the sticky side is, just around the edges of it. So I also have been putting hydrocortisone cream on the areas that have been burning because the skin was so irritated. This soothed it, and I got my doctor's approval to do it. So ask your doctor, but it helped me a lot. Today I took my first progesterone shot. Sorry if my dryer is loud. I was really, really nervous, so I honestly forgot to film it. I was just hyping myself up about this shot. I had heard they were very painful. Friends had told me they were painful. The doctor told me they were painful. I'm not gonna lie, it did hurt a little bit, but it really wasn't that bad. But let me show you. So, these are the needles that they inject you with, or you have to inject yourself with. And it has to go in kind of your upper bum area right here, upper butt cheek out to the side so you don't hit your sciatic. So I was very nervous. I had my mom come and do it because Deuce got called in for work, so he was unable to do it. And I just could not make myself poke myself with this needle. To make it a little easier, I did sit on a heating pad for about 10 minutes before my mom got here. And I laid down and I really tried to fully relax. My dog was kind of nestled by my face, so I was, cuddling him and focusing on that. I did feel a very sharp pinch as it broke the skin, and then just kind of pressure. It didn't really hurt until afterwards. Now I feel like kind of someone socked me in the butt cheek, like as hard as they can. It's very sore. It feels kind of like a bruise. So I'm gonna make sure I'm massaging it and I'm alternating butt cheeks each day. But yay, first one is done. It was not as bad as I was anticipating. The finish line is in the distance, guys. They are gonna be putting this embryo in me on Monday. It is Wednesday, so Thursday, Friday, Saturday, Sunday, Monday. 5 more days, they're gonna be putting a baby in me, and hopefully this will all be worth it. And hopefully I can be sharing this video with you soon with very good news about how it turned out. So I'm getting my second progesterone shot done. Today, Deuce is here. Zero's here comforting. You gotta stretch it out, stretch it out.
Stretch it.
Yeah, you stretch this good. Oh. No. Don't do it fast.
Ah, oh. Ah! Oh. I know, thank you, sweet boy. Thank you, sweet boy. Oh, look at him comforting mama. These are not fun. So I definitely recommend heating your butt with a heating pad prior, and then massaging it after. I made the mistake of yesterday not massaging, and I have like a big grape-sized lump on my butt cheek, and it's really sore, and it's not fun. But when this baby gets there, it'll all be worth it. Hi guys, so it is November 24th, about 9 p.m. We just finished my progesterone shot. I do it at the nighttime. Tomorrow morning is our embryo transfer. They are putting our baby in me tomorrow morning at 10 a.m. So I wanted to hop on and give you guys an update of how we're feeling. Emotions and everything are all very high. But like I said, I just finished my nighttime progesterone shot. I know I filmed one of them for you guys, but to be completely honest, they're getting harder. I want to be very open and honest and transparent with you through all of this process, so hopefully it can help some of you women out there. The progesterone shots are brutal. They're very painful. I have him do them for me on days that he can't. My mom comes and does them. But as your muscle gets more sore from getting injected, because it's a pretty, small area that you can be injecting in, it gets harder and harder. So those are pretty difficult. So if you are starting this process, prepare yourself for that.
But for you, man or women, you get to get booty rubs after.
Yep. You get booty.
That's like the plus on your side. So.
Yeah, you get booty rubs after to kind of help relieve some of that, tissue tightening up or whatever. It helps a lot. And heating pad as well, before and after, has been a lifesaver. And then make sure you're laying down and fully relaxed. That helps me a lot. But for tomorrow, we arrive at 10 a.m. I'm supposed to go pee an hour before and then drink a lot of water right after going pee, because they want my bladder full. Hey. They want my bladder full for the process. Zero's very excited for the process as well. I think he kind of senses our energy and our excitement. I know I'm very nervous. I've been kind of anxious and emotional all day.
It's like a roller coaster ride.
How are you feeling?
Just nervous.
Nervous?
Yeah.
Yeah.
I'm about to be a dad.
Yeah, I'm nervous as well, but excited to see the light at the end of the tunnel. I will have to be continuing the medications through this, still doing the progesterone shots, still doing the estrogen tablets in the morning and at night, as well as the estrogen patches and progesterone suppositories. So hopefully all of that will make sure that my uterus stays all happy and cozy for the baby to stay in there. But I just want to check in, give an update. Yeah, I will check in tomorrow after the procedure. Anything else?
My famous last words are, we'll see you soon.
And we'll catch you guys soon.
Oh, there you go. That one.
Okay, we're outside of the clinic, ready to go in. Put this baby in to bake. We just got home from my embryo transfer.
Hi.
He got me Chinese food on the way home because that's what I wanted. It went really well. She said we had no complications. It was really cool, really emotional. You go into the little room, they get me dressed in the gown and everything. And then the embryologist actually puts a video screen of your embryo, of your baby up on the screen, and then he comes in and he explains it to you and explains the health of it. Our baby was a 3BB, so they ranked from 1 to 5, 5 being the best and A's being the best. So it's pretty good in the middle, but towards the higher end of the middle, so we were happy with that. And when they defrosted it, they want at least 50% of the embryo to survive. 100% of our embryo survived. So the transfer went smoothly. It was a little uncomfortable. They make me go in with a full bladder, and they're pressing on my stomach with the ultrasound while she is doing the transfer. And then it was a little bit painful, some cramping and stuff. But they gave me a Valium, so I'm all relaxed and tired now. I'm gonna take a nap. But look, that's our baby. So we will come in about 9 days for a blood test to see if it's stuck and if I'm pregnant, and we'll go from there. Hi guys, so I just woke up from like a 5-hour nap. I was beyond exhausted. That Valium really got to me. But on my drive this morning, my friend AJ texted me reminding me to get a pineapple. Supposedly pineapple help with fertility and implantation. I wanted to know the science behind it, so I looked it up. So it says that pineapple contains bromelain, which is an anti-inflammatory and anticoagulation agent that per a 2012 study can impact the immune system. It also improves implantation by increasing blood flow to the uterus. So we're gonna cut up a pineapple. She specifically said to peel it and then cut it into slices. We're not gonna core it. So we cut the top off, and I'm gonna shave off all of the sides, and then I'll just dice it up in slices with the core and all. I did have a little bit of a scare, not last night, but the night before. When I went to the bathroom, I did have a little bit of spotting. It was not red, it was very, very light pink. And everything I'm researching online and everything my doctor says that is that light pink or light brown discharge is totally normal, and it could actually be a good sign. It could be some implantation bleeding. And that was on day 6 after the transfer. So I kind of panicked a little. I kind of had a little bit of a meltdown and cried, you know, after you have had a few losses. I mean, of course your mind's gonna jump to something negative like that, but I'm doing my best to stay positive. I haven't had any bleeding since. I feel a whole lot of commotion, like maybe slight cramping going on, but no other bleeding or any other crazy symptoms like that. So we go in tomorrow morning, Wednesday, for a blood test to see if the embryo's stuck. So fingers crossed. I cannot wait. Today cannot go by fast enough, but tomorrow we should find out what next steps are. Good morning, everyone. So I had my blood test this morning really early. I went in at 7:30 to give my blood. They called me back at about 11 today. So technically I am pregnant. I got a positive test, but my numbers are on the lower end. So they want your HCG levels to be at least a 24 to get a positive pregnancy test, and 24 to 80 is considered low positive. My numbers were 33. So I'm trying to stay positive. I'm a little emotional, but technically I am pregnant. I go in again in 2 days to take another blood test to see if my levels have climbed higher. So I will check in then. Yeah, I know you guys are watching this after the fact, but any prayers are gratefully appreciated. After going in for a couple more blood tests, we realized that my numbers weren't rising as expected, and the pregnancy ended up not being viable.
I was told to stop taking my meds, and I shortly lost the baby after that.
Hello everyone! So it's been quite a while since I have checked in and given you guys an update on my in vitro. Losing that first baby hit me really hard. I took a really long break from everything, but we ended up doing another mock cycle where I did all of the medications again, and we did a test that's called an ERA, which basically allowed my doctor to test the condition of the lining of my uterus when they do the implantation. So this allowed us to get a really ideal 4-hour window when to put the next embryo in. The last embryo got put in me on the 19th. Today is April 1st. On the 30th, I got a positive pregnancy test. I am now pregnant. My HCG beta numbers are really high. I had a second test today. They are climbing. I am beyond happy. I did my first pee stick. It's a positive. Look, guys. Literally, like, I never thought I'd be that happy to see 2 stupid pink little lines, but we are pregnant. Yeah, I have one more test to just kind of make sure things are going the way they should be, but we're looking really positive, and I'm looking that we're gonna be getting our little rainbow baby this year. So I'm probably definitely posting this video a lot later than this actually happened, but this is all happening during the COVID-19 scare, the coronavirus quarantine. So it's actually kind of nerve-wracking in a way because there is no research on what coronavirus does to pregnancy, early pregnancy or pregnant women or infants. So I've been on extreme quarantine. I have not been leaving the house. I'm not allowed to go to the grocery store. Literally my only socialization is taking the dogs around the block and waving to my neighbors from a safe distance. So it's been a way to at least relax, get some R&R and get over some of this nausea and let little jelly bean grow. But yeah, I hope everyone stayed safe during this. And again, this is probably being posted way after this scare is done and hopefully long past. Hi guys, I hope you're doing well. I have some news. So I had my first ultrasound and baby is doing good. We got to see the heartbeat. It was still too small to be able to hear it, but my heart is so full. I'm overflowing with joy. I finally feel like I can be excited. You know, I was so scared for that ultrasound because I've had 3 of them where I've gone in and I haven't seen the heartbeat. So that is such a devastating loss and created a PTSD for me to go into this ultrasound. But baby is strong. He or she is growing so fast. The doctor put me on an additional medication, so I was going to share it with you guys. I'm kind of a abnormal case. I do not think this is everyone's situation at all, but because of my past losses, this is kind of like a guinea pig trial and error thing. So I am on a blood thinner in addition to all of the IVF meds that I am continuing. So as of yesterday, I was 7 weeks. I will be continuing the meds, kind of dropping them off week by week. You know, on week 8, I'll drop off one of them. On week 9, I'll drop off another. But until 12 weeks, I will be on medication supporting my pregnancy. The one that they just assigned is this. It's another injection, yay. But it goes in my lower tummy. So I'm gonna show you that right now. Okay, so as you can see, I have little bruise marks from these injections. And then I have a patch right here. So I do wear a slow release estrogen patch. And I believe all women going through in vitro will wear this, but I'm just securing that really quick. I found they don't last very long, you know, especially if you are showering. Water will get in there and it just gets kind of damp and smelly and gross. So I use this surgical tape, the 3M kind of translucent one, and I apply a small layer over the patch to secure it in place. So you swap it once a week. I found that by applying this tape over it, it will stay secure for the full week and not get any gross water in there. It's pretty nasty when the water from the shower gets in there. It gets You know when like under a Band-Aid it gets damp and just ugh. That's what happens, and you have to wear this patch every week, and they're not cheap, so we want them to stay in place. So I apply it just like so. All right. Okay, so I'm going to clean with an alcohol wipe where I'm going to inject. I'm gonna come over here today, because I've been injecting over here the last couple days and it hurts over there. So this thing, it's kind of hard to maneuver. You have to yank firmly off the cap, and see it's a little teeny needle. It's really small. Then it's subcutaneous, so just like the first round of injections, I'm going to pinch a little roll of fat and poke it right in. Ow. So the needle doesn't hurt too bad. It's so tiny, but for some reason this fluid really burns when I inject. And it's quite a bit of it, so I just gotta fight my way through it. Anything to keep growing this baby. There we go. And this is kind of a cool little device, watch. It has like a needle shield that pops out. But I just want to thank you guys again for following me along on the journey. I'm almost to the point where I can announce our pregnancy to the world, and you know, a few friends and family members know, because they've been supporting me through the IVF journey. You need a lot of help during this. For any of you women that are going through this or starting this, it's a very difficult journey, and so that's why I decided to film this, to help you through it. I had a lot of questions. I had no idea what to expect myself, and it was so much harder than I ever could have anticipated, and so I hope this video is helping you. Please do not hesitate to comment or to direct message me on Instagram. I am there to help any female who needs my support through this, okay?